Here is a comprehensive and detailed explanation of the influenza flu vaccination in full depth. 1. Generic name, drug class, drug forms, brand name. Generic name, influenza virus vaccine, drug class, immunological agent, antiviral, prophylactic. Drug forms, injectable, intramuscular or intradermal. Inactivated influenza vaccine, IIV. Recombinant influenza vaccine, RIV. Adjuvanted or high-dose forms for older adults. Nasal spray, intranasal. Live attenuated influenza vaccine, L brand names, injectable, IIV. Fluzone, standard and high dose. Fluarix, Flulaval, Afluria, Flucelvax, egg-free cell-based. Fluad, adjuvanted for older adults. Flublock, egg-free recombinant. Nasal spray, Flumist quadrivalent. SHA2, definition. The influenza vaccine is a seasonal immunization designed to protect individuals against infection by influenza viruses, types A and B. It contains viral antigens, inactivated or live attenuated, from virus strains expected to circulate in the upcoming flu season. It is updated annually to match circulating strains due to frequent viral mutations. Mechanism of action. The vaccine works by stimulating the immune system to recognize and defend against the influenza virus. Inactivated or recombinant vaccines contain non-infectious viral proteins, typically hemagglutinin antigens. These stimulate the production of neutralizing antibodies without causing disease. Live attenuated nasal vaccine contains weakened influenza viruses that replicate in the nasal mucosa. This triggers a mucosal and systemic immune response. When the body encounters the real virus later, the immune system can rapidly identify and neutralize it, reducing illness severity or preventing infection. 4 indications: prevention of seasonal influenza illness, universal recommendation for individuals aged 6 months and older annually, especially important for adults 65 years, children 5 years, pregnant women, healthcare workers, people with chronic conditions, asthma, diabetes, heart disease, immunocompromised, residents of nursing homes or long-term care facilities. Half-5, contraindications, severe allergic reaction, anaphylaxis to a previous dose of the flu vaccine or its components, e.g., egg protein in some formulations. Live nasal spray contraindicated in children 2 years or adults 49 years. Pregnant women, immunocompromised individuals, children, adolescents on aspirin therapy, recent use of antiviral medications within 48 hours, people with asthma or recent wheezing. 6. Precautions before taking this vaccine. Inform your healthcare provider if you have severe allergies, including to egg latex, antibiotics like gentamicin, neomycin, are currently sick or have a fever, had Guillain-Barré syndromes within 6 weeks after a previous flu vaccine, are pregnant or breastfeeding, have a weakened immune system from disease or medications, have had a seizure or neurological condition, are taking antiviral drugs for flu. Note, people with mild illness, e.g. cold, can still receive the vaccine. 7. How to use. Injectable vaccine, given via intramuscular injection, usually into the deltoid muscle, upper arm, for infants, 6 to 36 months, given into the anterolateral thigh. Nasal spray vaccine Flumist, 1 spray into each nostril, only for healthy individuals aged 2 to 49 years and non-pregnant. 8. Dosing information. Age group formulation. Schedule. 6 months, 8 years, first time, inactivated, 0.25 to 0.5 milliliters, 2 doses, 4 weeks apart. 2 or 9 years, inactivated, 0.5 milliliters, 1 dose annually. Further 65 years, high dose or adjuvanted, 0.7 milliliter, Fluzone high dose, 1 dose annually. 2 to 49 years, nasal. Live attenuated, 0.2 milliliters or 0.1 milliliters per nostril, 1 dose annually. Missed dose overdose. If you missed your annual flu shot, get it as soon as possible during flu season. It remains effective even if taken late. Overdose. Rare and generally not serious. Multiple vaccinations may increase local reactions, e.g. redness, swelling. Seek medical attention if symptoms are severe or allergic reactions occur. 10. When to stop or avoid taking the vaccine. Avoid or delay if you have a high fever or moderate severe illness, wait until recovery, You had a severe allergic reaction to a previous flu vaccine. You are within 48 hours of taking antiviral drugs for nasal spray form. You're not within the recommended age or medical eligibility for the specific type. 11. Side effects. Detailed. Common side effects: mild, injection, inactivated, nasal spray life, soreness, redness or swelling at the injection site, runny or stuffy nose, low-grade fever, sore throat, cough, headache, fatigue, headache, muscle aches, fever, mild tiredness, nausea, decreased appetite in children. Severe, rare side effects: anaphylaxis, life-threatening allergic reaction, rare. Guillain-Barré syndrome, GBS, rare autoimmune nerve disorder, about 1 to 2 cases per million doses. Febrile seizures, more common in children, especially with high fever. Worsening of asthma or wheezing with nasal spray. Vital information. Best time to vaccinate: early in the flu season, usually by end of October. Takes 2 weeks for protective immunity to develop. Annual vaccination is essential because flu virus mutates frequently. Immunity wanes over time. Egg-free vaccines are available for those with egg allergies. Safe for pregnant women, only in activated form. 13. Other drugs that will affect the vaccine. Interaction. Influenza antivirals, oseltamivir, zanamivir, may interfere with live nasal vaccine if taken within 48 hours before or 2 weeks after immunosuppressive drugs, e.g., steroids, chemotherapy, may reduce vaccine effectiveness. Other live vaccines may require spacing if not co-administered, e.g., MMR, varicella. Warfarin or anticoagulants, minor bleeding risk with injection, apply firm pressure post-injection. Annual flu vaccine is crucial for individual and community protection. Different types available: injected, inactivated, and nasal live. Generally well tolerated with mild side effects. Safe during pregnancy and for most chronic conditions. Live nasal spray has specific age and health restrictions. Does not cause flu, but may cause mild immune-related symptoms. Thank you. Have a nice day.